Let's now proceed to the second part of liver qi stagnation in diagnosis according to Zanko organ pattern. A relevant advice for patients who has liver qi stagnation. When there is liver qi stagnation, it is best when possible to address and work with any mental emotional factors that can lead to liver qi stagnating. Stress should be avoided. Physical activity is beneficial because it circulates qi and thereby spreads liver qi. People whose liver qi stagnates often train a lot or work out. This is a form of self-medication where they consciously or subconsciously try to relieve or prevent their symptoms. The danger is, though, that some people begin to train excessively and damage their blood and yin as a consequence. A person whose liver stagnates should possibly be wary of playing competitive sports because the competition aspect may aggravate their condition, and when they lose or when their teammates do not do what they think they should. Dancing, aerobics, running, swimming, or cycling are good options because they can dynamically activate and circulate qi. Gentler forms of movement such as Tai Chi, Qigong, and yoga are also salutary because they help Qi to flow, but this can be perceived as being too slow or boring for people when there is liver Qi stagnation. The resulting frustration and impatience can aggravate their liver Qi stagnation. More dynamic activities are therefore often a better idea, at least in the beginning. Dancing will be a particularly good way to physically activate liver qi because it is usually a pleasurable activity and will therefore simultaneously nourish the heart. It is very important that these activities in which the person engages do not feel like things that have to be done, thereby becoming a source of frustration and further stagnating the person's liver qi. Shouting or singing are good ways to spread liver qi, especially because singing is pleasurable and thereby also nourishes heart qi. It can be a good idea to incorporate physical activity into the daily routine, for example, by cycling or walking to work instead of driving, taking the stairs instead of the elevator, or getting off the bus a stop earlier, or walking the last part of the journey. Breathing exercises that involve slowly inhaling deeply and then quickly exhaling with force whilst making a loud noise will help to release stagnant qi. A person whose liver qi stagnates should try to avoid eating too much at one time or eating rich food, especially concentrated proteins such as meat, dairy products, nuts, and food that has a high oil content because this will create further stagnation. Aromatic spices, herbs, and food that are slightly spicy will move qi, and care must be taken if this also have a warm or hot energy because qi stagnations tend to create heat. Unfortunately, people with liver qi stagnation are often attracted to alcohol and spices such as chili, precisely because their spicy flavor spreads the stagnant qi. Unfortunately, this often results in the generation of heat. Going for a walk after eating will help circulate qi in the body. A teaspoon of vinegar or lemon juice and a teaspoon of honey in a glass of warm water will help to temporarily relieve liver qi stagnation. Liver qi stagnation can be caused by liver blood deficiency, liver yin deficiency, and stagnation conditions elsewhere in the body. In turn, this can result to liver qi stagnation heat, liver qi invading the spleen, liver qi invading the stomach, stagnation of qi in the upper jaw, heart qi stagnation, liver blood stagnation, and liver fire. To summarize, liver qi stagnation has its etiology in prolonged emotional disturbance like a state of frustration, repressed anger, or resentment over long periods. Underlying or accompanying pathology are kidney deficiency, liver blood deficiency, spleen qi deficiency, and its signs and symptoms, melancholy, depression, moodiness, hypochondrial epigastric distension, feeling of oppression of the chest, sighing, irritability, premenstrual tension, irregular periods, premenstrual breast distension, clumps on throat, jaundice, and epilepsy. The pulse is wiry and the tongue is normal or slightly red sides. The treatment principle: course liver, rectify qi, resolve depression, harmonize liver and spleen and stomach. For the acupuncture treatment, we use pericardium 6 to regulate liver qi, liver 13 to harmonize the liver and spleen, liver 3 to force liver qi, bladder 18 to disperse liver stasis, gallbladder 34 to force liver qi, liver 14 to harmonize liver and stomach, and Sancho 6 to regulate the liver and ease the hypochondrium. For mental depression, we use heart 8 and do 26. For oppression in chest, we use red 17. For pain and distension in lower abdomen, we use liver 5 and liver 6. For plumstone throat, we use REN 17, pericardium 5, and REN 22. For breast pain, we use REN 17 and liver 14. We needle with even method and moxa may be used. Thank you for your attention.